Concurrent SARS-CoV-2 infection is associated with high rates of death or disability at 90 days in stroke patients. Analysis from a U.S. Comprehensive Stroke Center. By Nour Abdelhamid al 2021 JVIN. Background: coronavirus disease 2019, COVID-19, caused by SARS-CoV-2 infection is associated with cerebrovascular events. Given the novelty of this viral illness, there is paucity of data regarding this association. We aim to provide further evidence by reporting risk factors, clinical course and outcome in patients with SARS-CoV-2 infection presenting at our institute with cerebrovascular complications. Methods: we extracted a cross-sectional analysis of data from our institutional HOPE stroke registry to identify patients with SARS-CoV-2 infection who had cerebrovascular events. We analyzed the data and compared demographics, laboratory, and clinical presentations across all stroke patients during the peak pandemic period. Results: 22 patients with SARS-CoV-2 infection were treated at our medical center between March 2020 and October 2020. Majority of these patients, 80%, suffered acute ischemic strokes, while 20% experienced intracranial hemorrhage, itch. We found that the majority of our cohort presented with neurological manifestations, 77%, prior to the respiratory illness, yet the cause of mortality was largely secondary to the pulmonary complications of COVID-19, 56%. Patients with SARS-CoV-2 infection who suffered cerebrovascular events had a worse 90-day outcome, as defined by the modified Rankin Scale score. Additionally, patients with SARS-CoV-2 infection who received chemical or mechanical thrombolysis had high rate of intracranial bleeding, with 5 of the 7, 71%, treated patients dying during their hospitalization. Conclusions: neurological outcome appears to be worse in patients with SARS-CoV-2 infection when compared to patients without SARS-CoV-2 infection experiencing cerebrovascular events.